there is a gap today with the current reimbursement versus the current cost. So there's inflation. And for many years, the cost of care and the reimbursement were running parallel side by side, as well as the clinical capacity. So you had 3 tracks and they were running pretty equal and parallel. And about 10 years ago in home health, that the cost of care, meaning what it costs a provider to deliver home health, began to outpace the reimbursement. And at the same time now, there's a clinical capacity problem. So to deliver home health today at our current reimbursement structure is not sustainable, as you mentioned. So as a technology provider, how do we create technology that is meaningful to the clinician, but creates efficiency and capacity? Because we have to do that because the population is aging at a rate that we've never experienced before. We have access to care challenges. Today in the industry, we're probably turning away about 50% of patients into our ecosystem for a variety of reasons, but one of the top ones is clinical capacity. We don't have the clinicians to see the patients. And that's what we, from an advocacy standpoint, are really, really focused on in home care, home base, because we have that data and it's our job to shed a light on that in DC because we need to make sure that we don't continue to cut costs because the cost of care continues to rise and we don't have the clinical resources to meet that demand.